It's great to be here today and to be part of Health Visitor Week to talk about my favourite subject, which is public health of children and families and the many ways that health visitors are making a difference up and down the country. For those of you who don't know me, my name's Alison Morton. I work as the Head of Nursing at Southern Health. I'm also an HVweek Fellow and a visiting professional advisor at Public Health England. This presentation today is a repeat of a presentation that I gave last week at the Public Health England annual conference in Warwick as part of a session chaired by Viv Bennett. The title of the session was Improving Life Chances by Investing in Children's Health and Wellbeing, and I was asked to speak about the Universal and Universal Plus role of the health visitor. Health visitors are the visible face of public health. They are leading the delivery of the Healthy Child programme, supporting people to take responsibility for their own health and improving outcomes for children. As I only have a short amount of time today, I want to focus on the importance of the universal service and three of the high-impact areas: obesity, maternal mental health, and managing minor illnesses. I know many of you will have seen this quote before. It has been widely used recently. Yet I think we need to keep talking about it because it contains a powerful and important message. It really is easier and much less costly to build strong children than to repair broken men and women. Less costly in terms of finances as well as human suffering and unachieved potential. It describes the reason why we need health visitors, to give every child the best start in life. All children have hopes and aspirations, yet we know that some children are more likely to achieve their potential than others. Disadvantage exists. It starts early and the effects are cumulative and can last a lifetime. They often pass from one generation to the next unless we do something about it. And there is so much that can be done to improve public health. We're hearing the message loud and clear that we need to do it differently. We need to focus on what works, think outside the box, and remove the obstacles that stifle innovation and don't improve outcomes. Health in its broader sense does not just happen in hospital. If we really want to make a difference, we need to go upstream and tackle the greatest threats to our nation's health, which are largely preventable. We need a public health life course approach. In the 5-year forward view, there was a stark warning, and you can see the quote on the slide. If the nation fails to get serious about prevention, then recent progress in healthy life expectancies will stall, health inequalities will widen, and our ability to fund beneficial new treatments will be crowded out by the need to spend billions of pounds on wholly avoidable illness. So why health visiting? Because we know that children at risk of poor outcomes live in all postcodes. We need a universal assessment to ensure early identification of needs and targeted interventions for families needing additional support. Health visitors focus on the determinants of health and develop local integrated solutions to give every child the best start in life. Our universal service is often challenged. Some of that challenge comes from those who ask why we need to visit families who don't seem on the surface to have any needs. It was Marmot who first coined the phrase proportionate universalism. Marmot and his team at UCL concluded that in order to achieve the biggest improvements to health across the whole population, it is absolutely imperative that we deliver a universal service to all, with additional resources targeted at those with the greatest needs. The misguided belief that we only need to focus on the most disadvantaged will not reduce health inequalities sufficiently. All families are offered 5 mandated universal reviews as part of the Healthy Child programme. These are a great opportunity to catch up with families and see how things are going. We complete a holistic assessment. They're not just about child development, and health visitors will often pick up wider issues like domestic abuse and perinatal mental health problems. There are no hard-to-reach groups, and it reduces the stigma of asking for help, as everybody has a health visitor. Someone challenged me recently and said she didn't think the health reviews delivered by the health visiting service identified a single child who wouldn't be identified in any other way. This was quite a challenge to hear, yet it is important that health visitors are able to provide evidence of value for money and improved outcomes for children. In my trust, we undertook a survey of parents following their child's 2-year health review, and the results were really positive. We had 1,177 returned anonymous surveys. The health reviews identified unmet health needs in almost 40% of children. Age 2 is an important age when the gap between those children who are developing as expected and those who are not starts to widen, and children can steadily fall further and further behind their peers if their needs remain unrecognised. As a result of the Universal Health Review, these children were offered additional interventions to improve school readiness. Parents told us they remembered having conversations about a whole range of public health topics, as illustrated on the slide. More importantly, we were really pleased that most parents told us that they were going to make one or more behaviour change as a result of these discussions. So moving on to the high-impact areas. There are 6 high-impact areas, and they're all really important to achieve the best outcomes for children. But let's focus on childhood obesity, as it has received a lot of attention nationally. Obesity is a major public health threat. Most parents don't recognise that their child is overweight or obese. A slightly chunkier body shape has become the new normal. Tackling obesity is complex. Research and experience tells us that you can't just tell parents that their children are overweight and they need to feed them less. It does not work, and parents don't like it. They tend to just complain. Health visitors are taking a system-wide approach, doing it differently and working with people we have never worked with before. This slide shows just some of the many ways that we're doing this in Hampshire. We know that your chances of becoming obese are much higher if your parents are obese. We are working with our midwifery colleagues to target women with high BMI in pregnancy. Additional support is then provided by the health visitor, and many women are referred to Slimming World. In the community, we are promoting healthy lifestyles with increased physical activity from pregnancy onwards. The photograph in the background of this slide shows some of the mums at our Ready Steady Mums group that are springing up all over Hampshire. Mums are getting out, they're exercising, they meet other mums, which improves their social support networks and emotional well-being. It also gets them into the habit of exercising and getting out and about. Health visitors have helped to develop the Hampshire Breastfeeding Welcome Scheme in partnership with our midwifery colleagues and voluntary sector groups. Local coffee shops and other businesses sign up to this scheme and display stickers in their windows informing mothers that breastfeeding is welcome. And many mothers have told us that this makes breastfeeding out and about much easier and promotes a positive experience. We're also offering healthy eating groups in children's centres, and with our school nursing colleagues, we have been promoting a number of in-school initiatives to tackle obesity, including the popular Daily Mile. Moving to the right hand of the slide, to the universal contacts. All families are offered advice on healthy eating and physical activity, and then children with high BMI are offered additional support through a whole variety of programs with really great results. Children's BMI has decreased, parents have lost weight, and interestingly, so have many of the practitioners running the groups. That's a win-win for everybody. Maternal and infant mental health. This is really important because the estimated financial cost if problems are left untreated is huge, and many of this is due to the associated poor outcomes for children. 1 in 10 mothers will experience perinatal mental health problems, and many studies are now suggesting that the actual rate is much higher, probably nearer to 1 in 5 women. Having a baby is usually thought of as a happy time, yet many mothers and fathers do not feel like this straight away. When a mum says, "I don't think I love my baby," or "my baby doesn't like me," it can be a confusing, lonely and frightening place. And that is when having a health visitor to speak to is so important. There is a huge amount of stigma. We've done some co-design work with women in Hampshire to improve our perinatal mental health service. Reinforcing messages from national research, these mothers have told us that when they first start to feel that things are not right, they feel ashamed, they feel that people will judge them to be bad mothers, and most significantly, that someone will take their baby away. Every area needs inpatient perinatal mental health units, yet they only provide a tip of the iceberg level of support to a very small number of the most unwell women. Health visitors are seeing hundreds of thousands of women nationally every year with perinatal mental health difficulties. Health visitors play an important role in early identification, delivering evidence-based interventions, and providing a holistic approach to mothers, babies and fathers. There are some great examples of integrated perinatal and infant mental health pathways throughout the country, some with specialist health visitors. These are making a difference, improving parental self-efficacy, positive parent-child relationships and long-term attachment, as well as reducing parental anxiety and depression. So moving on to my last high-impact area that I want to talk about this morning, which is reducing A&E attendances and supporting parents to manage minor illnesses. This is another area of work where health visitors are thinking outside of the box and doing things differently, not just pouring extra resources into A&E, but addressing the reasons why parents are choosing to take their children to A&E. In the South, we are working with the Wessex Healthier Together team on an exciting collaborative project across Hampshire, Dorset and the Isle of Wight. Wessex data highlighted that about 80% of children who attended A&E did not need to be seen in a hospital. We didn't want to judge parents or prevent those who really needed to attend A&E from doing so. We just wanted to understand why help-seeking behaviours had changed in recent years, when on paper children were experiencing less severe acute illnesses than ever before, mostly thanks to the success of the childhood immunisation programme. So parents said that they were seeking peace of mind. The next one is interesting. They were worried about being judged by social services for doing the wrong thing. How did we get into this situation where parents felt afraid to use their own judgment? Parents also wanted to access services without delay, and interestingly, we found that if parents received consistent, explicit safety netting advice, they were much less likely to reattend. So as a result, Wessex Healthier Together resources were developed, and they aim to increase parental confidence. Health visitors have been trained. The resources focus on the most common reasons why parents were attending A&E, and they use a red, amber, green rating system with safety netting material to ensure that we're not missing children with serious illnesses. The resources are available on the website, as an app, and as group work material. Take a look at them. Search Wessex Healthier Together. They're now widely used in Wessex, and we're very pleased and happy for others to share and use them. Outcomes are important. So as part of this project, we're monitoring rates of NHS 111 calls, ambulance call-outs, and A&E and GP attendances. This is another really exciting project, and health visitors are playing a crucial role in getting this information out to parents. The initial feedback has been really positive. As I come to the end, I feel that I've only just scratched the surface by showcasing the importance of the health visiting universal contacts in 3 of our high-impact areas. Health visitors are doing so many great things up and down the country to improve access to healthcare, experience and outcomes for children and their families, with the overriding goal to reduce inequalities. With so many changes in health visiting recently, we need to build on this progress that we've made and be prepared to continue to think outside the box and address public health challenges at their source. That is where health visitors make the biggest difference. Health visitors are a highly skilled public health workforce, unique in so many ways. They're trained to work with physical and mental health, adult and child health, skilled in parenting support, behaviour change. They understand the wider context of the community and so much more. Most importantly, I think, is the way that health visitors work with all families in a strengths-based way. They work with families in the best and worst of times and get good outcomes. There are no hard-to-reach groups because everybody has a health visitor. These health visiting public health skills are very much needed to face the greatest threats to our nation's health that are really largely preventable and public health in origin. They're not going away unless someone does something. As a service, we really need to be more visible. We need to continue to improve outcomes for all children. We need to do proper evaluations of our work, and we mustn't ignore the evidence of what works and also what does not. So let's continue to develop truly integrated local services. Let's design them with and around the people who use the services. And if you're still not sure why you need a health visitor and you want to know what other people think of us, take a look at the many examples and testimonies collected by the CPHVA and other organisations as part of this exciting Health Visiting Week. This definition on the right-hand side of my slide is from the What is a Health Visitor group of slides. This one was written by Dame Professor Sarah Cowley, who puts into words what I think needs to be said. If health visiting didn't exist, it would be invented. So thanks for listening, and I hope you have a great Health Visitor Week. Thank you.